a slight bit of an overview of the vein, because actually the lymphatics are connected to the veins and how they are draining. The course is actually related to the venous drainage. So I'll be just telling you the veins which are concerned with the lymphatic drainage. We will be dividing the lymphatics into the two sets of groups. You will see that how they have been divided. They are in the superficial and in the deep group. So we will be discussing both the groups of the lymphatics of the upper limb. Now when we are talking about the upper limb, till now you know that the upper limb is comprised of the clavicle, which is the collarbone, and then it is connected to the limbic structure, that is from the arm to the forearm. There are different bones in the involvement in the formation of the upper limb. Like if we say the axial skeleton is connected to the appendicular skeleton, and when we talk about the axial skeleton, this axial skeleton is actually in the central part, which is the sternum, connecting to the appendicular, which are the limbs, which are connected to the center. Now, when we say the weight of this limb, that is especially the upper limb, is transferred to the axial skeleton through this horizontal line bone, which we call it as the collarbone. And ultimately, this appendicular skeleton, that is the weight, is transmitted from the collarbone to the sternum. So this is the base, or this is the logic of the axial and the appendicular skeleton. But now when we are talking about the lymphatics, that means that there are the lymphatics which will be coming from the appendicular skeleton, and they might be going to the clavicle. Because either above, either below, whatever, but they may lie just around the clavicle. So there are lymphatics which are coming from the limb, and from the limb I mean that there is a forearm, arm, even the region of the axilla, and then probably around and near the clavicle. So you have to keep in mind that the sets of lymphatics will be in this area of the origin. Now coming to the lymphatics of the upper limb. I told you that we divided the lymphatics into the two categories, and we say that there are certain superficial lymphatics of the upper limb and there are deep lymphatics of the upper limb. Now the superficial, we know that the superficial structures, what we mean is that just underneath the skin, and there are not much coverings or the muscles, probably the fascias will be there, but not much things will be present over there. Now when we talk about these superficial lymphatics, now how they arise and how they go. The concept arises again from the veins. Now when we talk about the arterial supply, what happens? We know that the aorta is one of the major vessels. You must have the previous knowledge where we say that arch of aorta, the abdominal aorta, or the thoracic aorta. We divide the aorta into three categories. That is the ascending aorta, the arch, and the descending aorta. And this aorta is giving major branches. And they are taking, and what does the artery do? It takes the blood from the heart and distributes it to all the parts of body. And what type of blood does it carry? It carries the oxygenated blood. Exceptions are there, like the umbilical and the pulmonary. We take these are the exceptions, but in a major way, we just study that the arteries carry pure blood. Now, when we talk about the veins have a counterverse route, or you can say, we don't say, if we talk about artery, the artery is coming from up and then spreading like a tree. It is giving like branches. But the veins are actually coming from below, and then they are acting as a tributary, like a river. What happens that the small streams, small tributaries, they come and they open in a big channel. That is a big river. For example, if we talk about the river Indus or anyone, there are small streams which are coming and they are draining into it. So this is the tributary system, and this is the venous system, and this is what is happening over here as well. So the veins are coming just opposite to the direction of the artery, and then they are coming and just draining into a big chamber, and then they are ultimately draining into the inferior vena cava or a little bigger venous system where they will be carrying the deoxygenated blood. So in a way, they are collecting the blood from the body where the artery has distributing it. When once the blood becomes pure or impure, it is collected by a vein and then it is ultimately drained to the major venous system of the heart, and then it is taken into one of the chambers of the heart so that it can purify it. This is a normal mechanism of the body. Now what happens to the lymphatics? The lymphatics is quite close to the venous system. It is again the same way as the veins are coming. It is coming in the opposite direction, and then it might be entering at the junction of the venous system as well. But now what happens when we talk about the lymphatics of the upper limb, I said that there are two lymphatics, which we say the superficial and the deep lymphatic. How they are formed, we will just look at this limb. If you see this limb, this is the distal part of the limb. And over here, if you can see, there is a number of vessels which you can see, it is forming like a plexus. Now these plexus, they are actually known as the lymphatic plexus. And these lymphatic plexus lie very superficially or just underneath the skin, and they actually form a network, and this network is just in the extracellular spaces of the hand. And through this, the superficial lymphatic vessels are formed. How? By the network of the lymphatic plexus. And where does this lymphatic plexus lie? In the hand superficially, and forming a network of plexus which are known as the lymphatic plexus. Now when once they are formed, now this is actually the lymphatic plexus which you are seeing over here. This is formed in the hand. Now this lymphatic plexus will ascend upwards. When we say ascend, that means going upwards. So this will go upwards. Now over here you can see the main veins of the arm, and these are also the superficial veins of the arm. Now when we talk about the superficial vein, there are three veins which are very important and we will be studying them. And we say that one is on the lateral side. Now I think by now you know what is the lateral and what is the medial side. Now when we talk about the lateral and medial, we mean that when we are standing in an anatomical position. Now I am standing in an anatomical position, so my arms are going to face forward. My arms will not be like this. My arms will be facing forward. And the side, that is the little finger side, this will be taken as the medial side. And the side of the thumb is taken as the lateral side. Now there is a vein which is present on the medial side, and there is a vein which is present on the lateral side. Now if you look over here, this must be the lateral side because you can see the thumb over here. This must be the lateral side, and this must be the medial side. Now remember, the vein which is present on the medial side is known as the basilic vein. Now see over here, this is actually the vein which is present on the medial side, and this is the basilic vein. The vein which is present on the lateral side is known as the cephalic vein. So this you can see, this is the cephalic vein. Now these two veins are also interconnected to each other, and that is a vein which is, and they are connected through an oblique vein, and we call this vein as the median cuboidal vein. Now this is the vein, the medial cuboidal vein, which is the site of when we draw the blood from the hand. You must have seen this is the area from the cuboidal fossa. Where is the cuboidal fossa? Just in front of the elbow joint. Now this is the area where you can see the prominences of the vein, and in the center you will see one, even you can see it in your hand, you will be looking at the fluid structure and you will find the median cuboidal vein. So these are the superficial veins which are easily located and from where you can easily draw the blood. Now this median cuboidal vein is actually connecting the cephalic and the basilic vein. So the medial vein is the basilic and the lateral vein is the cephalic vein. Now, if you see upwards, you have seen that once the lymphatic plexus arises, now this lymphatic plexus, they are going upwards. They are ascending upwards. And if you see the connection, they are in very close proximity to the superficial veins of the upper limb. So they are in connection with the lateral as well as the medial vein of the upper limb. Now, if you look at the medial side first, this is the basilic vein. This one is the basilic vein. Now, if you look at this, what happens? The lymphatics which were ascending upwards and which are in close proximity to this vein, that is the basilic vein, what do they do? There are a set of lymph nodes which are present at the cuboidal fossa. Now, the set of lymph nodes which are present at the cuboidal fossa must be the cuboidal lymph nodes. So, the veins which are traveling or which are ascending in close proximity to the basilic vein, they go and drain into the cuboidal lymph nodes. Now, this cuboidal lymph nodes simply lie medial to the vein, and even if you just look at the bony structure, the medial epicondyle of the humerus will be here. So this is actually in relation or proximity to the medial epicondyle of the humerus. The kya lymphatic plexus, they form, they go upwards in relation to the basilic vein, go and drain into the cuboidal lymph nodes, where they are present in the cuboidal fossa, medial to the vein and proximal to the medial epicondyle of the humerus. Now, when once they are in the cuboidal region and they are from here further going to go upwards. Now, when they go or when they ascend upwards, there is a set of lymph nodes which are known as the axillary lymph nodes. Now, over here, if you see, if you remember my class of axilla in which I just described, there are 5 groups of axillary lymph nodes in which we did the interior, that was the pectoral, the posterior, that was the subscapular, then there was a lateral humeral, then there was a central, and then there was an apical group of lymph nodes. Now, what happened here, if you see, from here there was the cuboidal lymph node. Cuboidal lymph node takes it up to the axillary set, and if you see over here, they are arranged, and this one is actually the lateral or the humeral group of the lymph node, because they are taking the lymphatic of the upper limb from the limbal structure or from the upper arm to the humeral or the lateral, which is the closest group present near the basilic. So ultimately, they will be draining into the lateral or the humeral group of the axillary lymph node. So the lymphatics from the basilic side are ultimately draining into the lateral or the humeral group of the lymph nodes. Is it clear? Then we come to the next set, which is lying on the sapphire side. That is the lateral side. Medial side हमने देख लिया, basilic था, cuboidal group of lymph nodes में गया, then it drains into the lateral or the humeral group of axillary lymph nodes. Now, when we talk about the lymphatics which are lying in close proximity to the cephalic vein. Now, these lymphatics will simply ascend upwards, and they are just crossing the arm. They will be crossing the shoulder as well. And what do they do? They go and drain into the last set of group. If you remember the rest, I told you the lymphatic drainage. In the lymphatic drainage or even in the axillary lymph nodes, I told you that the 3 groups drain into the central, and the central ultimately drains into the apical group of lymph nodes. This was actually the basic of it. Now over here, the one which is lying on the lateral side, what happens, it crosses the arm, it will cross the shoulder, and then it will directly go and drain into the apical group of lymph nodes. But this is the majority of the set of lymphatics that drain into the apical group of lymph nodes. But there are certain lymphatics which will not drain directly into the apical group. What do? There is, if if you remember, this is a collarbone, that is the clavicle. And the clavicle has a groove present which we call it as the deltopectoral groove. And underneath the deltopectoral groove was the deltopectoral triangle. And over there is a set of lymph nodes lie, and we call those lymph nodes as the deltopectoral lymph nodes. So some of the lymphatics, instead of going to the apical group of the axillary lymph nodes, they go and drain into the deltopectoral group of lymph nodes. So what happens? On the basilic side, they go upward to the cuboidal fossa, drain into the cuboidal lymph nodes, and then ultimately they will be draining into the lateral or the humeral group of the axillary lymph nodes. But the set of lymphatics which are present on the lateral side, that is the cephalic vein, they crosses the arm and the shoulder, and the majority of them will be draining into the apical group of axillary lymph nodes. Only some of them will be draining into the deltopectoral lymph nodes. Now, so now you have a major concept that what is happening on the lateral and on the medial side. Now, if we go according to the terminologies, or we say that the lymphatics are draining actually into the axillary lymph nodes, the medial side into the lateral or the humeral group of the axillary lymph nodes, and the lateral side into the apical group of the axillary lymph nodes. But how do we divide? We take it as the medial three fingers, which will be draining or which will be closer to the basilic vein, and they will be the one which will be draining into the lateral group of the axillary lymph nodes. Now when we are talking about this supratrochlear, they are the same as the cuboidal lymph nodes. Then if we talk about the lateral side, they were in close proximity to the cephalic vein, and they include the index and the thumb finger, and they were actually going into the apical group of the axillary lymph nodes, and we also call them as the infraclavicular group of the axillary lymph nodes, because that is the group, the apical group, which is lying just inferior to the apices, and that is why, and that is the place where the deltopectoral group or the deltopectoral lymph nodes are also lying in close proximity to the infraclavicular or the apical group of axillary lymph nodes. So this is actually the superficial lymphatics, and if you see over here, this is, you can see this is the basilic vein, this you can see this is the cephalic vein, and if you see from here the lymphatic vessels from the lymphatic plexus, they go in close relation to the basilic vein. Over here they will be draining into the cuboidal lymph nodes or the supratrochlear lymph nodes, and from here they will go and drain into the lateral or the humeral group of axillary lymph node. Over here, this is the cephalic vein which is lying on the lateral side, and the lymphatic vessels, they just go and crosses the arm and the shoulder, and they go and drain either into the infraclavicular or the apical group of the axillary lymph node, or that is the deltopectoral lymph node, but that is a very minor percentage. Majority of it goes and drains into the apical group of axillary lymph nodes. Now we come to the deep lymphatics. Now these lymphatics are actually present in relation to the structures which are lying deeply, or they are related to the veins which are present deeply. Superficial lymphatics, superficial veins के साथ में, deep lymphatics, deep veins के साथ में. Superficial lymphatics जो superficial veins के साथ में, they are actually the cephalic and the basilic and the medial cuboidal veins which are lying superficially. But when we are talking about the deep lymphatics or the deep veins, now the major veins जो हमने brachial plexus के नाम के साथ arteries की हैं, like the radial artery, the ulnar artery, the median artery. Now they all have a vein as well. Now these are the radial vein, ulnar vein, median vein. Now these are present more deeper as in comparison to the superficial structure. So the radial, ulnar and the brachial veins, they are actually the deep sets of veins which are present, and the lymphatics which are present in relation to them, they are actually the deep lymphatic vessels. Now lymphatic vessels. Where do they drain? Now they are also going to the drain into the humeral group of the axillary lymph node. That is the lateral group. So the lateral group or of the axillary lymph nodes or the humeral group is the primary lymphatic or the primary drainage area of the upper limb. Because why? Because the superficial lymphatics are also coming and draining into it, and the deep lymphatics, which are also lying in relation to the deeper structures, they are also coming and draining into the lateral group or the humeral group. But the special thing about this deep lymphatic is that they are not only draining the deeper structures, but they involve the capsule, the joints, the tendons, even the periosteum of the bone, because they are lying in the deeper structure. So they can cover everything which is present inside, even the periosteum of the bone, which is most deepest inside. So it will be covering the drainage of that structure as well, and then draining into the deep set of group or the lateral group of the axillary lymph nodes. या तो बहुत ज़्यादा समझ आ गया या कुछ समझ नहीं आ रहा, because बातें इतनी शुरू हो गई हैं, ठीक है? And this is actually the main set of group, but there are certain additional lymphatic vessels which are also present in the ascending part, but they are not of main concern. But we should remember that the deep lymphatics are draining into the humeral group of the lymph nodes. Now, if we talk about this deep lymphatics में खास बात ये होती है कि एक तो ये deeper vein से भी connected होते हैं, plus they are also connected to the arteries. They are actually following the course of the arteries. And these deeper lymphatics are fewer in number as in comparison to the superficial lymphatic. So we say that they are less numerous, and these deep lymphatics, we have seen that they are draining the structures which are even beyond the deep fascia, like we have seen the capsules, we have seen the periosteum. So they are draining much deeper structures which are lying in the body. And again, the termination point is the same, that is in the lateral group of the axillary lymph node. And that lateral group of axillary lymph node is the same as the humeral group of the axillary lymph node. Now, again, if we see the collective view, that is the superficial and the deep. Superficial में हमने दो sets में किया था, the lateral and the medial. When we talk about the lateral side we included the thumb and the index finger, and this thumb and index finger was actually following the cephalic vein, and then this cephalic vein was going and draining into the infraclavicular or the apical group of the axillary lymph node. Some might say a small percentage also drain into the deltopectoral lymph node. Then we talk about the medial part. The medial part, I told you, involves the medial three fingers. From here, they follow the course of the maxillary vein, and from here, they reaches to the medial epicondyle, where the cuboidal or the supratrochlear lymph nodes will be present. And from there, they will go and drain into the lateral group or the humeral group of the axillary lymph nodes. And then we talk about the deep lymphatics. The deep lymphatics were very easier to remember. They were lying deeply, less numerous, follow the course of the arteries. So they will be in relation to the arterial structures which are present deeply, and they will also go and drain into the lateral group of the axillary lymph nodes. So these are actually the lymphatics of the upper limb. Now I will just ये हमारी basic जो lymphatic drainage थी वो हो गई. But now I will discuss these 5 groups which we have studied. That the axillary group of lymph nodes were having the 5 sets of nodes which we categorize as the anterior, posterior, lateral, central and apical. Now if you see over here, if you remember, when or we say the muscles of the front or muscles of the pectoral region that is the pectoralis major, minor, हम यही कर रहे थे ना सबसे, इसलिए सारे हम muscles of the pectoral region कर रहे हैं. उसमें से we did one muscle that was of prime importance, that was the pectoralis minor muscle. And why? Because the pectoralis minor was actually dividing the course of axillary artery as well into the three steps. The pectoralis minor was passing from in front of the second part of the axillary artery, and because of it we say that there are three parts of axillary artery present. And for convenience we remember the first part was above the pectoralis minor, the second part was underneath the pectoralis minor, and the third part was below the pectoralis minor muscle. And then we also remember that all together, the axillary artery was giving 6 branches. The first part with 1 branch, the second part with 2 branches, and the third part with 3 branches. The first part was giving which branch? Superior thoracic artery. The second part? Lateral thoracic and the thoracoacromial artery. The third part? Circumflex humeral, that is the anterior circumflex humeral, the posterior circumflex humeral, and the subscapular artery. Subscapular की खास बात क्या थी? It was giving further 2 branches, that was the circumflex scapular and the thoracodorsal artery. So this was actually the course, it was just the revision of the axillary artery. But now this pectoralis minor again is having a very important set of things, because if you see these group of axillary lymph nodes, they are also lying in relation to the pectoralis minor. And if you see, we classify them as the anterior group, which is lying very next to the pectoralis minor muscle. Now this anterior group, please, I need silence. मुझे इतना पता है कि जो सुनेंगे, they hardly need 10 minutes at home to just revise this. But when you will go back home and when you will study yourself, believe me, you won't be able to retain it, although it seems that's a very simple topic. So when we are talking about this pectoralis minor muscle, the lymph nodes, the set of lymph nodes which are lying in close relation to the pectoralis minor muscle, we call them as the anterior group of the axillary lymph node, and that is why this anterior group is also known as the pectoral group of the lymph nodes. Then if you see, this is the anterior, which is the relation to the pectoralis minor muscle. Then if you see, the lymph nodes which are farther away from this and slightly towards the back side, and this is known as the posterior group of the lymph nodes. And when we talk about the posterior group, we have also done the posterior group as the muscles of the scapular region, if you remember. So we also give the name as the subscapular group or the posterior group of the axillary lymph nodes. One group we have already done, and we know it should be related to the humerus, and the major drainage of the lymphatic of the upper limb is actually into that group that is lying along the humerus. We call it as the lateral group of the axillary lymph node, and that is also called as the humeral group of the axillary lymph nodes. And then if you see in the center, this is actually known as the central group of the axillary lymph node, where all the 3 groups, after receiving the drainage from everywhere, they drain over here, that is the central group of the axillary lymph node. And once the central group receives the drainage from all these 3 areas, this itself goes and drains into the infraclavicular group, that is also known as the apical group of the axillary lymph nodes. तो किस तरह हमने किया? हमने anterior group कर लिया, एक posterior किया, एक lateral किया, जो कि humerus के साथ था. Anterior, posterior, lateral, the 3 drains into the center point, and from the central, all the lymphatics they drain into the apical. So these are the 5 groups of the axillary lymph nodes. Now if we come to the individual set, that is the first one, that is the anterior or the pectoral group of the axillary lymph node. Now these, if you see over here, even they are almost like 3 to 5 in number. The number is not fixed, they can be 3 or 5, they are 3 to 5 in number, and they actually lie along the medial wall of the axilla. अब वो जो हमने axilla pyramidal shape किया था with the apex and the base ये सारी, उसकी जो medial wall थी, this pectoral group or the anterior group lies in the medial wall of the axilla. Now mostly this anterior axillary lymph node is the prime structure which receives the drainage from the breast. वो जो breast की जितनी जो mammary gland की जितनी drainage आ रही होती है, वो सारी जो है वो pectoral group of the lymph nodes या anterior axillary group of lymph nodes में आती है. तभी now if you see, most commonly in the axilla it is recommended to check your lymph nodes. Why? Because any inflammation, any infection may lead to the palpation or the palpable lymph nodes. Normally the lymph nodes are present, but they are not palpable. They are not palpable. They will be only palpable when any infection is going on and they have enlarged in size, and because of the enlargement they have come outside superficially. That indicates that there is something going on. And mostly we palpate the axillary lymph nodes with a certain position or a certain form of an examination, and that, especially for females, we say that it is one of the earliest indication of the malignancy as well, because in the cancerous stage these lymph nodes gets enlarged. And since the lymph node, the anterior axillary lymph node or the pectoral group is a major drainage of the mammary gland. Now, if you see the exact position of this anterior group, if you remember when we were doing the pectoralis minor, that was actually indicating the second part of the axillary artery, which was giving two branches. One was the thoracoacromial and one was the lateral thoracic. And if you remember, this lateral thoracic was running on the lower border of the pectoralis minor. If you see, this is the pectoralis minor, and this is the lateral thoracic artery, which is running on the lower border of the pectoralis minor muscle. And this is also the site where the anterior axillary lymph nodes will lie. That means this anterior axillary lymph nodes are in close relation to the lateral thoracic artery. Is that clear? Then we come to the posterior group, which was also known as the subscapular group. Now I've told you that this was actually the posterior side of the set, and this is known as the subscapular group of lymph nodes. Now this posterior group has more number of lymph nodes in comparison to the anterior group, and we say that this has almost 6 to 7 posterior lymph nodes which are present, and they must be lying along the folds. If you remember, we did the anterior axillary fold, the posterior axillary fold. This posterior group lies on the posterior group of the axillary fold. Now what happens, again, this presence on a little bit on the posterior side of the scapula, so the main lymphatic drainage which it will receive is coming from the posterior side or from the scapular region. So the posterior side drainage will come and drain into the posterior or the subscapular group of the axillary lymph nodes. Now if you see, when we talk about this posterior group, I said that it is present in the posterior axillary fold, almost 6 to 7 in number, receiving the lymph from the subscapular and the posterior group of posterior scapular region. Now there is a certain extent to which it receives this lymphatic drainage. ये posterior group जब हम scapular region में जा रहे हैं, तो it is actually coming out of the appendicular part. ये अब axial skeleton की तरफ जा रहे हैं. Axial skeleton में जब हम जा रहे हैं, तो ये trunk का part भी पीछे से include कर रहा है. And there has to be a limitation कि कितना area है जो कि आपके posterior group में drain कर रहा है. Now when we do the lower limb में there is a bone which is known as the hip bone. we have a pair of hip bones, and one hip bone itself is comprised of 3 bones, and we call them as ilium, ischium and pubis. Now the ilium has a crest. We call it as the iliac crest. Now this iliac crest is actually the boundary of this posterior group of the lymph node, because it is actually receiving the lymph from the posterior side of the trunk and the scapular region till the point of the iliac crest. So this is actually the posterior group or the subscapular group of the lymph node, 6 to 7 in number, present in the posterior axillary fold, receiving the lymph from the posterior side till the trunk till the iliac crest. Then we come to the third one, that is the lateral group or the humeral group of the lymph node. अब तक हमने जो lymphatic drainage की है उसमें इन्हीं group हमने सबसे ज़्यादा involve किया है. That is the lateral group and the humeral group of the lymph node. अब इनका number in between inferior and posterior है, तो हम उनका number लेते हैं almost 4 to 6 in number. Presently कहाँ था? हमने कहा था कि ये humerus के side पे होते हैं lateral group, हम इसको कह रहे हैं. They must be present in the lateral wall of the axilla. Medial wall of the axilla, the interior group of the axillary lymph node, and lateral group of the lymph node is present at the lateral wall of the axilla. Now, I told you this is the primary drainage of the upper limb. The primary drainage of the upper limb is coming and draining into the lateral or the humeral group, because we have seen the superficial lymphatics which were connected to the basilic vein, they were going and draining into the lateral group, and the deep lymphatics which were related to the arterial course, they were also going and draining into the lateral group of the axillary lymph nodes. So this is the major drainage of the upper limb from where it is receiving the lymphatics. Then we come to the one where all these 3 groups, that is the interior, posterior and the lateral, is draining, and that is the central group of the lymph node. ये थोड़े से कम होते हैं in number, they are almost like 3 to 4 in number. Now this again, present तो ये वही axilla में होंगे, deep inside the axilla, and they will be again present very close to the second part of the axillary artery, that means in relation to the pectoralis minor muscle, but anterior group जो था वो pectoralis या second part की branch से related हो रहा था. I told you that the lateral thoracic which was running on the lower border of the pectoralis minor was related with the anterior group of the axillary lymph node. जबकि ये जो central है ये थोड़ा deep inside होगा, related to second part ही होगा, but this is present in deep relation and therefore this is also related to the second part. And I told you इसके अंदर सारे lymphatics आ जाएंगे, the anterior group के, posterior group के and the lateral group के. So this becomes easy. Now what happens over here? ये तीनों receive कर रहे हैं lymphatics. There is a nerve which is passing. We call it as the intercostobrachial nerve. Now this intercostobrachial nerve is actually passing through the central nodes. If the nodes are enlarged because of anything like a carcinoma of the breast, the most common condition in malignancy, so what happened? It will put pressure on this nerve. So intercostobrachial nerve will be compressed because of the pressure which is present because of the enlargement of the lymph node over there. And once the pressure appears, what it leads to? It leads to the pain on the medial side of the arm. So this is a condition which is connected to it because of the pressure, because of the malignancy which is present over there. Then we come to the last set of the group, that is the apical, or we also call it as the infraclavicular group of the lymph nodes. Now this infraclavicular, apical से हमें वैसे नहीं लग रहा है कि ये apex पे होगा. That is why the word apical has been given, because it is actually related to the apex of the axilla. So this is actually located in the apex of the axilla. Again, at that point there will be the axillary vein, which was the medial-most structure present in it over there. And so this apical lymph node will be present in close relation to the axillary vein, and this is almost lying on top of this axillary vein, and therefore it will be related to the first part of the axillary artery. सेकेंड पार्ट से हमने दो देख लिए थे, एक इंटीरियर ग्रुप को देखा था हमने, जो कि सेकेंड पार्ट से था, और एक सेंट्रल ग्रुप को देखा था, जिसमें से इंटीरियर ग्रुप लैटरल thoracic के साथ था, और जो सेंट्रल था वो बिल्कुल डीपर था इन द axilla. Now when we talk about this apical, this is related to the first part of the axillary artery, directly in relation to the axillary vein lying in the apex of the axilla. Now we know that this apical group will receive the lymph from all the other lymphatics, like the central. Central में तो सभी आ रहे थे, interior भी आ रहा था, posterior भी आ रहा था, lateral भी आ रहा था. So all the four groups will ultimately go and drain into the apical group of the lymph nodes. Now this apical lymph nodes also receive the limbs. If you remember, हमने जो cephalic vein की थी, cephalic vein के साथ हमने किया था कि they crosses the arm, they crosses the shoulder, and then they grow and drain into the apical and the infraclavicular group of the lymph nodes. So there are certain lymphatic vessels which are smaller, and they are also accompanying the cephalic vein. They will also go and drain into the apical group of the lymph nodes. Now when we talk about the apical हमने कहाँ देखा? Apex vein, closely related to the axillary vein and related to the first part of the axillary artery. यही हमने किया. अब होता क्या है कि यहाँ पे once they reach the apical lymph nodes, now from there the effluents come out of the apical lymph node and then travel through a canal which we call it as the cervicoaxillary canal. Again, अगर याद हो जब axilla हम कर रहे थे तो ऊपर से जो space बन रही थी जहाँ structures were connecting the axilla and the cervix या cervical area, neck का area, we were calling it as the cervicoaxillary space or the canal. So from there, after draining into the apical lymph node, the efferents they go and travel into the cervicoaxillary canal, and then they converge either to form the subclavian and the lymphatic trunk. अब इसमें थोड़ा सा difference आ रहा है. जो right side पर है, if you look at this right side, the right subclavian trunk, this actually continues to form the right lymphatic duct. जो right side पर है, this will continue to form the right lymphatic duct. जबकि जो left side पर है, left side पे they directly. राइट साइड पे हमने ये तो बता दिया कि राइट लिम्फेटिक डक्ट के फॉर्म करेंगे, लेकिन होता क्या है कि ये जो है यहाँ पर ये एंगल नजर आ रहा है, दिस इज द वीनस एंगल. ये वीनस एंगल किसके बीच में है? इन बिटवीन, ऊपर से अगर हम देखें तो ये नेक पे एक वेन जा रही है जिसको हम कहते हैं इंटरनल जूगुलर वेन, और दिस वेन व्हिच इज फॉर्मिंग एन आर्च, दिस इज एक्चुअली द सबक्लेवियन वेन. तो ये जो राइट लिम्फेटिक डक्ट है ये इसके जंक्शन पे एंटर होती है. If you see this point, यहाँ पे ये जो लाइन आ रही है, this is actually the junction between the subclavian vein and the internal jugular vein. This is happening on the right side, that it is forming the right lymphatic duct, and it is entering at the junction or at the venous junction. And what is this venous junction? This is a junction between the internal jugular and the subclavian vein. What happens on the left side? Left side पे ये directly enter होती है into the subclavian vein through the thoracic duct. ये directly कोई junction पे नहीं enter होती, यहाँ पे भी junction है, but this directly enters into the subclavian vein through the thoracic duct. The right side पे there is a lymphatic duct, left side पे there is a thoracic duct, and the lymphatic duct is entering into the junction between the subclavian and the internal jugular vein, whereas the thoracic duct is directly entering into the subclavian vein. So this is how the apical system has now travelled into the, or it is merged with the venous system. वो जो पूरी lymphatic drainage आई थी, अब वो directly subclavian vein में चली गई. So this is how what is happening over here, and this is actually if you talk about this intraclavicular or apical flow, we have seen that it was actually lying at the apex of the axilla, much deeper in relation to the axillary vessels, and from the axillary vessels we mean directly on top of the axillary vein related to the first part of the axillary artery, and we have seen that it received all the length from the other set of the groups of lymph nodes, that is from the central, anterior, posterior and the lateral group, and then we have seen that this will ultimately go and drain into the subclavian duct. On the right, through the lymphatic duct, which is actually entering on the junction between the subclavian and the internal jugular vein, whereas on the left side, through the thoracic duct, which is directly entering into the subclavian. So this was the collective form of the apical group of the lymph nodes. अभी छोटी छोटी सी एक lymph nodes रहती है जिसमें हमने क्या था, एक हमने की थी deltopectoral group of lymph nodes. Deltopectoral group of lymph nodes क्या थी, जो cephalic vein से drain कर रहा था. On the lateral side, it was mostly going and draining into the apical group. But some of them, they goes and draining into the deltopectoral lymph nodes, which was lying into the deltopectoral group. Then there was another set of the lymph nodes जिसको हमने कहा था cuboidal या फिर supratrochlear lymph nodes. Now when we are talking about this cuboidal or the supratrochlear lymph nodes, they were actually lying along the cuboidal fossa. Cuboidal fossa में I told you that they were lying just superior to the medial epicondyle of the nucleus, and that is why we are giving the name as the supratrochlear lymph nodes. The point of the drainage, since the medial side of the lymphatics were coming and draining into it, so it will be draining the medial side of the hand, the medial side of the forearm, which will be coming and draining into the supratrochlear or the cuboidal group of the lymph nodes. This is मेरा ख्याल से summarized there. I expect everyone to know, because when we see the palm, even the palm and the dorsum of the hand, both of them forming the lymphatic plexus. From the lymphatic plexus, it will start to go upwards as the superficial cell, it will ascend. And in the superficial cell, it will divide it into the lateral side and the medial side. Coming to the medial side is the basilic vein, where the lymphatics which are related to it will be the cuboidal lymph nodes. And these cuboidal lymph nodes along the course of the basilic vein goes and drains into the uveal or the lateral group of the lymph nodes. And from the uveal and lateral group, we also know that it will actually go and drain into the central group, and from the central it will be going and draining into the apical group of the axillary lymph nodes. And from the apical, we have seen that they will ultimately go and merge with the subclavian lymphatic trunk. This was actually the sequence on the medial side. If we see the lateral side, when it was going and draining to the cephalic vein, we have seen that most of it, majority of it, goes and drains into the apical group of the lymph nodes, and from the apical again it will go into the subclavian lymphatic trunk. But we have also seen that along with the cephalic vein, there is another set of the lymph nodes, that is the deltopectoral group, which is lying over there. So the sum of the lymphatics will also go to the deltopectoral lymph nodes, and which will also ultimately go and drain into the subclavian lymphatic trunk. This was the superficial set of the lymphatics which were present at the upper end. The deep were actually related to the arterial system which was present, or the deeper structures which were present inside, and we have seen that the deeper structures were also going and draining into the lateral or the nuchal group of the axillary lymph nodes. And then this deep system, they will actually join the tendons and the nerves which are present inside. So this is the total lymphatic system of the upper limb. ठीक है, अब इसकी थोड़ी सी अप्लाई हम जल्दी कर लेते हैं. इसको मैं नहीं करूँगी because we have seen the deep lymphatics में in present है. I told you to the deeper structures, that is the arterial system, brachial artery और वो तरीके present होती हैं. Now you can see over here. Can you see a note here? Can you see? And this is a point of the cuboidal fossa. ये वही medial epicondyle का area है. So this is actually the supratrochlear lymph node. This is a condition in which it is an immunosuppressive disease, that is or you can say a viral disease, आप कह रहे not necessarily. Syphilis is a condition where the supratrochlear lymph nodes are enlarged and you can palpate these lymph nodes in your cuboidal area. I think 2 minutes more. This is actually a mammary gland which is very important. Again, we have seen the most, I told you, the most of the drainage of the mammary gland is into the inferior or the pectoral group of the axillary lymph nodes. Although there are other sets which we will do with the breast, then we have a criteria in which we divide it into the 3 levels of the lymph nodes, and that is actually again according to the pectoralis minor muscle. We classify them as the first degree level. This is actually the anterior group of the axillary lymph nodes, which is coming in the first level. Then this is the pectoralis minor muscle, and underneath it you can see this is the lateral group over here. Then even the posterior and the central group over here, which is coming in the second degree level of the classification. And the third one you can see, that is the infraclavicular group or the apical group of the lymph node, which is coming in the third degree level of the classification. And this classification is actually according to the pectoralis minor muscle, which is passing and indicating the conditions. So this is again the lymphatic conditions where it is enlarged, and this is actually known as a condition in which we say lymphangitis, that is the inflammation which is present over there. Now if you see, this is again you can see a raised area over here, and this is an enlarged lymph node which is present, and we call this condition as the lymphadenitis, in which you can see again it's an inflammation, but this is an inflammation of a lymph node, and due to which you can see that this is enlarged and it must be palpated when you do the examination. Now if you see, this is actually, you have seen there is a swelling, a marked swelling which is present over here, and this is a condition because we know it as the lymphedema. Edema is actually a swelling state, and this is due to the obstruction in the lymph vessel, which leads to the edema or the swelling state, and this is the lymphedema which is present. So this was the end of it. I hope इसके बाद